Breaking news this morning as Eli Lilly sues 4 major telehealth companies offering compounded Tirzepatide. We're going to get into what Eli Lilly is alleging this time and who has been the target of their lawfare. If you're new here, welcome. My name is Dave Knapp. I'm the man on the Mounjaro. That's why I'm here. You are on the pen. We talk about Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, Compound. We talk about bariatric surgery, really any news that is pertinent to people living with type 2 diabetes or obesity. And we bring you the news from the patient perspective so that you can have more competent and confident conversations with your medical providing team. So thank you for being here. If you're new here, hit the subscribe button. We drop news all the time. In fact, if you jump over to onthepen.com, we covered this thing first thing this morning. It is huge news as Eli Lilly has continued their lawfare against anyone offering compounded Tirzepatide. We know that med spas and prescribers and even some pharmacies have been on the receiving end of cease and desist letters. We even know some lawsuits have been filed, but this sort of takes it to the next level. So jump over to onthepen.com and get updates on this throughout the day as we gain more insight and information. But I want to give you some top level information about who have been the targets and what Eli Lilly is alleging here. So the 4 targets of these lawsuits filed in district court in California are Mochi Health, that's the big name, Fella and Delilah Health, Willow Health Services, and Henry Meds. Now, Eli Lilly is specifically calling out the compounded versions that would fall under the 503A category. So compounds that have been made and mixed, compounded with different amino acids or vitamins. Of course, they point this out as a safety issue in their opinion, as none of these have been evaluated or cleared by the FDA. That is the case with all compounded medications. They're not alleging patent infringement near as we can tell at this point. Instead, the company is framing this as a safety issue, warning that these compounded versions might be risky or ineffective for patients. But they also take it a little bit farther in some of these lawsuits. So Lilly also claims that these telehealth companies are not just selling these unapproved versions of Tirzepatide, but that they're actively shaping the prescribing process in ways that raise red flags. And according to the filings, Lilly alleges that some of these platforms steer patients toward compounded medications without adequate medical evaluation, often relying on pre-filled templates or quick online forms. The concern is that these companies may be prioritizing sales over safety, influencing doctors to prescribe in bulk or outside standard clinical judgment. This accusation adds a new layer to the battle, calling into question not just the product, but the entire process by which it reaches the patient. So that's sort of the different angle in these lawsuits than what we have seen so far. Now, we knew that Eli Lilly was not going to sit on their laurels and allow 503A formulations to sort of be mass produced and mass marketed the way that the 503Bs were during the FDA sanctioned shortages. I say that, choose my words carefully, because we have amassed a pretty good number of reported people reporting shortages at onthepen.com/report, which we will be submitting to the OFA to submit as evidence in their lawsuits. We talked yesterday on the podcast about these lawsuits going on in district court in Texas between the OFA and the FDA are really the firewall to protect the safest versions of compounds, because this is the natural progression, right? When you take away the 503Bs, you move to 503A custom doses and custom formulations. This is the way that Lilly's actions and the FDA's actions have pushed the market. You saw yesterday on the podcast as well. If you're not following the podcast, wherever you get your podcasts, we drop a podcast every Tuesday, which sort of gives you a rundown of what's going on in obesity medicine for the week. We talked about how some telehealth companies are going so far as to offer formulations of Tirzepatide that include semaglutide. You heard that right. So the active ingredient in Zepbound mixed with the active ingredient in Wegovy to create some sort of super GLP-1. It's being marketed. It's the wild, wild west out there. And it's because custom dosing and custom formulations are the legal framework that exists currently to offer compounded medications. Since the 503Bs, the mass compounding was removed with the ending of the shortage. And so this sort of all leading up to a big day in court on Thursday in the Tirzepatide trial between the OFA and the FDA, which we'll be following very closely. Hopefully we'll get the chance to sit down with Lee Rosebush, the chairman of the OFA, and talk a little bit about whatever comes of that. But sort of getting back to the matter at hand, these lawsuits, which tend to lean more towards calling into question the framework by which compounds are prescribed by these 4 telehealth companies. It's interesting to see pharma taking issue with the way these are prescribed, because you have to wonder if these push people to branded options, would they have the same opinion about it? Would they be filing lawsuits over them? Probably not. And if you think about the ways that big pharma over the last couple of decades have influenced prescribing by themselves, right? Very, very intentionally. You can talk about lunch and learns. You can talk about paying doctors to speak on their behalf. You can talk about even salespeople going into doctors' offices and offering free samples of medications. There are many, many ways that big pharma has relied on influencing prescribing, but now that it is telehealth companies that are helping patients get access to the affordable versions, it apparently is lawsuit worthy. So we will continue to unpack this information as we get more of these filings in our hand. We will be following that all very closely at onthepen.com. So please jump over there and scroll to the bottom of the page and just sign up for email alerts really quick. If you would have been on the email list, you would have gotten this breaking news at 6 a.m. this morning. So when you woke up and had your morning coffee, you would have been able to get all the information that existed on this breaking news first thing this morning. So couldn't encourage you more to jump over there and sign up for email alerts. If you're watching on YouTube, please hit the subscribe button. Listen, there are about 35 to 40% of you who watch our videos who are not subscribed. We would love to have you as a subscriber. And if you hit the bell for notifications, you will get a notification every time that we go live or drop a new video. And so much of this is breaking news. And so if you want to get the breaking news and that's important to you, not only should you subscribe, but you should hit that bell for notifications. We're traveling to DC today. We will be updating the article at onthepen.com as we get access to more of these documents. Thank you for being here today. Thank you for being the best part of what we do at On the Pen. You, the patients, are why we bring you this patient-centric news and information. We really appreciate each and every one of you who follows along, and we're going to be bringing you some great content over the next couple of days, so stay tuned as OTP goes to DC. We'll check in the next one.